King Charles' cancer journey timeline in full as he addresses nation. Major update as the nation waits to hear King Charles' personal address to the nation this evening. The Mirror takes a look back on the monarch's cancer journey so far, from his return to public life to his warm chats with fellow patients. King Charles delivered a personal message to the nation tonight, opening up about his cancer diagnosis. The 77-year-old monarch has given an update about his recovery, while emphasizing the importance of cancer screening programs, putting his name to a joint campaign between Cancer Research UK and Channel 4. The King, whose recorded video message was broadcast this evening at 8 p.m., gave a rare insight into his condition, which was first detected during treatment for an enlarged prostate back in 2024. While the monarch has not disclosed what kind of cancer he was diagnosed with, the palace did confirm that it wasn't prostate cancer. Ever since sharing his cancer diagnosis with the world, King Charles has spoken bravely about his health journey, meeting with fellow cancer patients and even hosting a special evening reception for cancer charities at Buckingham Palace. Here, the Mirror takes a look at Charles' cancer journey. Andre Covery so far. The 26th of January 2024, King Charles was pictured arriving alongside Queen Camilla at the private London clinic, the same hospital where his daughter-in-law, Princess Kate, recuperated from her abdominal surgery, for scheduled treatment of an enlarged prostate. Prior to his own operation, Charles is understood to have visited Kate, reports the Mirror. The King was this morning admitted to a London hospital for scheduled treatment, Buckingham Palace confirms in a statement. His Majesty would like to thank all those who have sent their good wishes over the past week and is delighted to learn that his diagnosis is having a positive impact on public health awareness. After the procedure, Queen Camilla says of her husband, "He's doing well." 29 January After spending 3 nights at the London clinic, Charles departed the hospital. He was pictured leaving through the main entrance with his wife, Queen Camilla, who had been by his side every day throughout his stay. The King was this afternoon discharged from hospital following planned medical treatment and has rescheduled forthcoming public engagements to allow for a period of private recuperation. He would like to thank the medical team and all those involved in supporting his hospital visit, and is grateful for all the kind messages he has received in recent days, the palace says in a statement. 4 February The King and Queen made an appearance at church in Sandringham, with Charles beaming and acknowledging well-wishers, marking his first public appearance since his procedure. 5 February Merely 1 day afterwards, Buckingham Palace revealed King Charles' cancer diagnosis. During the King's recent hospital procedure for benign prostate enlargement, a separate issue of concern was noted. Subsequent diagnostic tests have identified a form of cancer, the palace says in a statement. His Majesty has today commenced a schedule of regular treatments, during which time he has been advised by doctors to postpone public-facing duties. Throughout this period, His Majesty will continue to undertake state business and official paperwork as usual, the statement continues. The King is grateful to his medical team for their swift intervention, which was made possible thanks to his recent hospital procedure. He remains wholly positive about his treatment and looks forward to returning to full public duty as soon as possible. His Majesty has chosen to share his diagnosis to prevent speculation and in the hope it may assist public understanding for all those around the world who are affected by cancer. King Charles personally broke the news to his sons, Prince William and Prince Harry, about the diagnosis, and also directly informed his siblings, Princess Anne, Prince Andrew and Prince Edward, before the announcement was made public. 6 February The King was spotted for the first time since revealing his cancer diagnosis. Both he and Queen Camilla were captured driving away from Clarence House, their London residence. They acknowledged onlookers through the car window as they headed to Buckingham Palace, before travelling by helicopter to Sandringham House. King Charles had just held talks with his younger son, Prince Harry, who had flown from California to London to visit his father after hearing the news. Their encounter reportedly lasted just 45 minutes. 10 February The King conveyed his sincere gratitude for the supportive messages he had received. In his own statement from Sandringham House, the King remarked, It is equally heartening to hear how sharing my own diagnosis has helped promote public understanding and shine a light on the work of all those organizations which support cancer patients and their families across the UK and wider world. 21 February King Charles conducted his first in-person audience with then Prime Minister Rishi Sunak since revealing his cancer diagnosis. The Prime Minister assured the monarch, "We're all behind you. The country's behind you." The king responded, "I've had so many wonderful messages and cards. It's reduced me to tears most of the time." Later that same day, Charles perused get-well cards that had been sent to the palace, and a photograph and video of him reading the cards were subsequently released. 21 March During a solo visit to Northern Ireland, Queen Camilla provided an update on her husband's condition whilst visiting the Arcadia Delicatessen in Belfast. "He's doing very well. He was very disappointed he couldn't come," Camilla remarked, via Hello magazine. She also quipped that she attempts to keep him in order when a member of the public observed that men often don't make the best patients. 22 March Following the Princess of Wales' announcement that she is also undergoing cancer treatment, a Buckingham Palace spokesperson revealed that King Charles is so proud of Catherine for her courage in speaking as she did. The spokesperson further stated that both the King and Queen will continue to offer their love and support to the whole family throughout this difficult time. 24 March Peter Phillips, Charles' nephew and son of Princess Anne, discussed the King's health during an interview with Sky News Australia. He revealed that Charles was in good spirits, but ultimately, hugely frustrated. He's frustrated that he can't get on and do everything that he wants to be able to do. But he's very pragmatic. He understands that there's a period of time that he really needs to focus on himself. He continued, but at the same time, he is always pushing his staff and everybody, and his doctors and nurses to be able to say, "Actually, can I do this? Can I do that?" So the overriding message would be that he's obviously very keen to get back to a form of normality. And he's probably frustrated that recovery is taking a little longer than probably he would want it to. 27 March King Charles was hospitalized due to side effects of cancer treatment. Buckingham Palace confirmed King Charles had been admitted to the London clinic following scheduled and ongoing medical treatment for cancer this morning. Charles had experienced temporary side effects that required a short period of observation in hospital, which also led him to postpone his royal engagements both that day and the next. 28 March Charles returned to Clarence House for recovery and was seen being driven in a car, waving to bystanders as he passed. 31 March The King attended an intimate Easter Sunday service in Windsor with a select group of royals, including Prince Edward and Sophie, Princess Anne, and Prince Andrew and Sarah Ferguson. Prince William and Kate were absent with their children following the announcement of Kate's cancer diagnosis. This marked Charles' first significant public appearance since January. 26 April Buckingham Palace announced that Charles would resume his public duties, but confirmed that his treatment is still ongoing. His Majesty the King will shortly return to public-facing duties after a period of treatment and recuperation following his recent cancer diagnosis, read the statement. It was also revealed that he and Queen Camilla would visit a cancer treatment center the following week to mark his return. 30 April The King undertook his first public engagement since his diagnosis with a visit to the University College Hospital Macmillan Cancer Centre in London. When asked about his health, he responded cheerfully, "I am all right, thank you, not too bad." 17 May Charles revealed his first overseas trip since his diagnosis, confirming he would journey to Normandy, France, on June 6, 2024, alongside Queen Camilla, to attend the Ministry of Defence and the Royal British Legion's commemorative event at the British Normandy Memorial on the 80th anniversary of D-Day. It would mark his first international engagement since his cancer diagnosis. 15 June Charles headed the royal family at his second trooping the colour since becoming king. Due to his health, he travelled in a carriage alongside Queen Camilla rather than on horseback. His daughter-in-law, Princess Kate, was also present, making her first appearance of 2024 at trooping whilst undergoing her own cancer treatment. A Buckingham Palace spokesperson said the king was delighted she is able to attend, and that he was very much looking forward to all elements of the day. 18 October the King and Queen arrived in Australia to begin their autumn tour, which would also take them to Samoa before returning home on Saturday, October 26. It represented Charles' first visit to any of the 14 Commonwealth realms outside of the UK since becoming their head of state in 2022, and the first time in 13 years that the country has welcomed its head of state on Australian soil. Additionally, it was the King's first major overseas tour since revealing his cancer diagnosis. 28 October Buckingham Palace has given a hopeful update on Charles' health. A palace official stated, "We're now working on a pretty normal-looking full overseas tour program for next year, which is a high for us to end on, to know that we can be thinking in those terms." 9 December President Donald Trump disclosed that Prince William discussed his father's health with him during a meeting in Paris. He told the New York Post, "I asked him about his wife and he said she's doing well. And I asked him about his father, and his father is fighting very hard, and he loves his father, and he loves his wife, so it was sad." The 6th of April 2025 King Charles and Queen Camilla embarked on a 4-day visit to Italy, which included a brief private meeting with the late Pope Francis at the Vatican, who later passed away on the 21st of April. 7 April to mark their 20th wedding anniversary on the 9th of April. Charles and Camilla released a new photo showing the couple smiling and appearing relaxed in images taken shortly after they arrived in Italy for their state visit. They posed for pictures in the gardens of Villa Walkinsky, the British ambassador's residence in Rome, with the Queen wearing a lily-of-the-valley brooch, a symbol of enduring love. The caption read, "As we begin our first visit to Italy as King and Queen, we are so looking forward to celebrating our 20th wedding anniversary in such a special place, and with such wonderful people. A presto, Roma e Ravenna. Charles R. and Camilla R." 17 April the King cracked a wry joke about his well-being whilst attending the customary Maundy Thursday Easter service at Durham Cathedral alongside his wife. Following the ceremony, the royal pair met supporters who had assembled outside the cathedral, including Pat Johnson, 54, who was cradling her 3-stone 18-month-old Pembrokeshire corgi called Lilibet, which captured the King's attention. Speaking later, Mrs. Johnson revealed, "He asked me if she was friendly and he asked me her name. I said she was named after the late Queen. I said he looked very well and he said, 'You are very kind, it's all smoke and mirrors.'" April 30th ahead of a special evening reception for cancer charities at Buckingham Palace, Charles shared his most personal reflections yet about his illness. As per a message shared on the royal family website, each diagnosis, each new case, will be a daunting and at times frightening experience for those individuals and their loved ones. But as sown among those statistics myself, I can vouch for the fact that it can also be an experience that brings into sharp focus the very best of humanity. It has certainly given me an even deeper appreciation of the extraordinary work undertaken by the remarkable organizations and individuals gathered here this evening, many of whom I have known, visited and supported over the years. And it has reinforced what I have long observed during these visits, that the darkest moments of illness can be illuminated by the greatest compassion. Quoting the late cancer awareness campaigner Dame Deborah James, who died at the age of just 40 in June 2022, the King continued, "And to those who may be receiving such upsetting news today, tomorrow or at any point in the future, I can only echo the departing words of the late Dame Deborah James, whose parents I am delighted to have with us here this evening, and whose example stands as an inspiration to us all, in sickness and in health. Find a life worth enjoying. Take risks. Love deeply. Have no regrets, and always, always have rebellious hope." May 16th during an away day in Bradford, Charles revealed he would like to think he is on the better side of his cancer journey. During his visit to Impact Hub Yorkshire, the King offered an update on his condition while chatting with florist Safina Khan, who presented him with a bouquet inspired by the gardens of Highgrove. According to Safina, Charles gave her the thumbs up when she inquired after his health, telling her, "I'd like to think I'm on the better side of my cancer journey." May 29th following his visit to Canada, senior palace sources have revealed that Charles was focusing on the next stage of his reign, and was by that point used to living with cancer. The source added, "The thing you learn about this illness, cancer, is that you just manage it." And that's what he does. Medical science has made incredible advances, and I genuinely see no difference in him. As long as you just do what the doctors say, just live your life as normal as possible, and that's exactly what he is doing. It's no secret that he is still having treatment, but because he is incredibly fit, he is just dealing with it all incredibly well. July 22 during a trip to Jockey Club rooms in Newmarket, the King spoke about his health during a meet and greet in the Suffolk town centre, where more than 1,000 people turned up to see him. Lee Harmon, 54, from Bury St Edmunds, recalled, "I asked him how he was, and he said he was feeling a lot better now and that it was just one of those things." September 3 while visiting the New Midland Metropolitan University Hospital in Birmingham, King Charles opened up during a chat with patient Matthew Shinda, 73, from Oldbury, who had been diagnosed with prostate cancer. Matthew told the monarch, "I've got what you've got," before sharing, "Last stage. I could go today, I could go tomorrow." Charles asked how long Matthew had been there and asked, "Have they been giving you all the right treatment?" "Marvelous nurses." He also joked that you have to go up endless lifts to go anywhere in the building. Matthew told the King, "It's nice to see that you're recovering well," to which he replied, "I am not too bad, thank you very much." The patient then revealed, "I have the same disease, it's prostate. Last stage. I could go today, tomorrow." While Charles had been undergoing treatment for an enlarged prostate when doctors detected the cancer, Buckingham Palace has not confirmed what type it is. It's also understood not to be prostate. Charles told Matthew, "Half the problem is detecting it, isn't it, in time." Matthew proceeded to explain how he had been diagnosed when doctors found a previously undiscovered lump. Charles continued, "As long as they're making you comfortable." Matthew responded, "Of course. That's one of the priorities. Making me comfortable." Charles said, "The great thing I think is they're getting better and better at dealing with these things. The trouble is, there's always hope down the road. I am sorry about that, it's so frustrating." "We're probably about the same age, are we?" Matthew remarked that the King was about 1 year older, sparking a laugh from the monarch. November 5 a royal author claimed that, according to senior members of staff within the royal household, a significant shift in King Charles' demeanor has been noted, the Express reports. In his latest book, The Windsor Legacy, A Royal Dynasty of Secrets, Scandal and Survival, royal expert Robert Jobson writes, "Indeed, his longer-serving staff have detected a change in their employer, whom they feel could occasionally seem rather cold. He's now become more emotional, they say. Not only that, Buddha's changed some of the habits that once seemed set in stone, largely due to advice from Dr. Michael Dixon, a seasoned NHS GP and advocate of complementary medicine who was appointed head of the royal medical household after Queen Elizabeth's death. William, too, has urged his father to slow down and listen to his medical team. As per Jobson, Charles has made several lifestyle changes, including taking regular afternoon naps and reintroducing lunch into his daily routine after a lifetime of skipping a midday meal, with spinach soup being a favored choice. The monarch is also said to frequently jest with pals about reaching that worryingly decrepit stage in life. December 12 the King revealed his cancer treatment schedule is being reduced in the new year almost 2 years after his diagnosis. Charles, 77, has been receiving weekly treatment since learning he had an undisclosed type of cancer in early 2024. In a brand new message to the nation last night, the monarch gave a significant update about his cancer journey while stressing the importance of cancer screening programs to help early diagnosis of the disease. His message, which was recorded just over a week ago in the morning room at Clarence House, was broadcast on Channel 4 as part of its Stand Up to Cancer campaign. It comes at the end of a week-long series of fundraising events and celebrity challenges to raise awareness about screening and generate support for those with cancer. The King revealed, "Today I am able to share with you the good news that thanks to early diagnosis, effective intervention and adherence to doctors' orders, my own schedule of cancer treatment can be reduced in the new year. This milestone is both a personal blessing and a testimony to the remarkable advances that have been made in cancer care in recent years. Testimony that I hope may give encouragement to the 50% of us who will be diagnosed with the illness at some point in our lives.